Okay, hello. Our group will be presenting on the topic of health accessibility amongst the uninsured. Our group members include Olivia Kelly, Diana Marcos, Hannah Hanzo, and myself, Anita Robertson. Next slide, please. We will first present a case study to provide an example of what some of the ethical challenges individuals in the U.S. face when they are uninsured. Oh, sorry. In this case, we have Miss C, who is a 35-year-old West African woman who came to study in the U.S. 7 years ago. During her study, she developed debilitating glaucoma and stopped her studies. She eventually married, became a U.S. citizen, had 2 children, and moved to Indiana. Unfortunately, she had no health insurance because of unemployment, and her husband does intermittent construction work. Over the course of 2 months, she develops lymphadenopathy and the symptoms progressively worsen. The hospital willing to accept her is 2 hours away in Indiana, so she resorts to a closer hospital, but it is in another state, Kentucky. Ms. C is sent referral to various hospitals, mainly in Kentucky, and finds out she is diagnosed with stage 3 Hodgkin's disease with poor outcomes. The social worker works to expedite her Medicaid application, but Indiana only accepts diagnoses from within the state. As a result, referrals are made to community-based oncology clinics, but the patient refuses to transfer her care from Kentucky. All these hurdles cause her to have a delay in starting treatment. Next slide. As you can see, those who are uninsured have multiple hurdles that prevent them from accessing care more readily. The ethical issues with this case is the inability for providers to offer the best medical care because of barriers such as finances or social factors. These challenges result in the inability to attain treatment in a timely manner, thus resulting in poor health outcomes. Next slide, please. Some of the U.S. background data on the uninsured individuals are presented in this slide. These data are based on the CDC's data. As of 2022, 27.6 million Americans of all ages do not have health care, and out of that, 3 million are children. With private insurance, 2/3 of people under 65 are covered, and with public insurance, 27.8% are covered. In 2014, the Medicaid expansion started and covered eligible for families under the age of 65 who are below the poverty line, but not all states adapted the coverage. States who did not elect into Medicaid expansion had people who were twice as likely to be uninsured. Next slide. You might be wondering why people are uninsured in the first place, given that the US has public and private insurance companies that individuals can select from. Here are the top 3 reasons according to the Commonwealth Fund. Those who are 19 to 64-year-old who are surveyed responded that first, they did not think they could afford health insurance. And based on your family size and income levels, both public or private insurance can be a costly expense. Secondly, some individuals who lost or dropped coverage stated that they were unable to pay for their health plans. Thirdly, amongst those who were lost or dropped from coverage, they were no longer eligible due to various reasons, such as changes in income levels. So these are the top reasons why millions of Americans are still uninsured.
Okay, so a little bit more background. Why is this important? Why is having health insurance in general important? So some quick facts. If you don't have insurance, a 3-day hospital stay can cost more than $30,000. So you can imagine how much a week-long or a month-long hospital stay would cost. 1 in 10 adults in the United States owe medical debt because of how expensive medical bills can be. And interestingly, more than 45% of the US population relies on prescription drugs to manage their illnesses and disease progression. So many people need health insurance to continue their health and well-being. That brings us into the second point, improved health. So people that have health insurance have a better self of health and well-being. They're connected to the appropriate types of care, more coordinated types of care, and more regular care, so they can get followed up regularly. This helps manage long-term and chronic illness. This leads to decreased emergency department use and increased outpatient use, so better disease management long term. And this also leads to decreased mortality. Another thing to note is that if you have health insurance, you're likely receiving preventative services such as screening for diseases and vaccines. Finally, there's a major impact that having health insurance makes. Number one, it alleviates stress in somebody, being sick and worrying about how you're going to pay for your bills is very stressful. Having health insurance alleviates that stress a little bit. There's less paperwork for patients, improves community ties, reduces financial strain and medical debt. So if you have health insurance, there's an out-of-pocket maximum, so a cap on your yearly spending, incentivizing use of healthcare resources and helping cover imbalances with otherwise socioeconomically disadvantaged groups. And this is something we'll get into a little bit later when we talk about cultural factors.
So the healthcare accessibility dilemma among the uninsured in the United States is closely tied to social and cultural factors that impact beliefs, behaviors, and health-seeking patterns. Uninsured rates are disproportionately high in underprivileged neighborhoods because of differences in income and other socioeconomic factors. Cultural attitudes towards healthcare affect individuals' the propensity to use the healthcare system, such as stigma, trust in medical institutions, and health literacy. See, these variables aggravate health outcomes among the uninsured and contribute to inequities in the use of, preventative treatment. The problem is further complicated by the diverse cultural perspectives in the US due to its many and varied ethnic and social communities. People from some cultural backgrounds are less likely to use traditional medical services because of their emphasis on alternative medicine or their choice of a particular type of healthcare provider. Additionally, linguistic and cultural hurdles might need help getting to know the complicated healthcare sector. Cultural norms influence access to healthcare on a worldwide scale. Cultural norms in various nations may affect the timing and way people seek medical attention. Cultural and societal norms may constrain healthcare access where socioeconomic gaps are common. Culturally, trust and acceptance within healthcare systems are needed to reduce healthcare inequities in the US and worldwide. Next slide, please.
Okay, so diving a little bit deeper into some of the points we mentioned. Number one, the US is the only high-income country without universal health coverage. This is really significant. Essential healthcare in the US depends on income more than in any other country. So we have a culture here that breeds fear and barriers to using health insurance, even among those that have it. Interesting story with me, I was traveling in Greece with my American friend, and she fell on a piece of glass and cut open her leg. And although she was bleeding profusely, she refused to seek medical attention because it was so ingrained in her head that if she were to seek out care, she would go into debt. And so therefore she would rather choose to be sick. And eventually we ended up dragging her to the hospital. She got stitches and some antibiotics. And ironically, the cost of the whole procedure was only €2. Which is under $5. So really, really interesting what we have bred into our minds as Americans. One other quick point is that already been made. People of racial and ethnic minorities have disparities in healthcare coverage, but just breaking it down here, there's a little chart on the right that shows 20% uninsured American Indian, Alaska Native, and Hispanic, 10% uninsured Native Hawaiian, Pacific Islander, and Black, compared to only 7% uninsured white.
So to improve healthcare access for the uninsured in the United States, developing practical and recommended strategies to address this issue is essential. It is crucial to push for healthcare reform that covers more people and is more universal. Fixing the problem of widespread lack of health insurance requires removing policy holes and legislative hurdles. It is crucial to enact and enforce anti-discrimination legislation that guarantees everyone, regardless of socioeconomic situation, equal access to healthcare. Ethical consideration should be given top priority to including people from all walks of life in clinical trials and studies so that results represent the uninsured population. The cultural and social determinants of health that lead to inequality should also be the focus of research efforts. Health literacy and community education programs should also be strongly encouraged, increasing information about accessible healthcare services, preventative measures, and the necessity of early intervention can enable individuals to navigate the healthcare system more efficiently. Next slide, please.
We only have 1 minute left, just heads up.
Okay. Private and public sectors, healthcare providers, and community groups must work together to improve people's health. Partnerships can make creating services easier, specifically addressing the needs of the uninsured. Examples of this are community clinics and outreach initiatives. A commitment to ethical norms anchored on justice and equity values should govern these strategies. Essential values to respect when providing medical care include self-determination, beneficence, and non-maleficence. It is possible to build a healthcare system that is more accessible, egalitarian, and ethically sound for the uninsured by connecting policy, research, and community participation with ethical norms. Affordability is a key reason that 30 million adults remain uninsured.
And we have 20 seconds.
To conclude this, the healthcare accessibility dilemma among the uninsured in the US through thorough and ethically updated response of systemic healthcare reform, including changes in legislation, anti-discrimination laws, and a shift toward universal coverage, is required to address the complex problems. To be considered ethical, research procedures need to emphasize diversity of thought and cultural understanding. Partnerships in the community and efforts to improve health literacy are critical in enabling individuals to make sense of the healthcare system. By combining these methods driven by concepts of justice and equity, one can work toward providing uninsured individuals with access to high quality medical care that is also affordable and morally acceptable. Next slide. These are our references, and thank you for listening, everyone.
Thank you, everyone.
Thank you.